Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in these beautiful projects of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free training classes on clinical hypnosis with several free ebooks. How to overcome the first day and face the following days. Just like the first day, during the next 4 or 5 days, you will often feel a very strong desire to smoke, which will produce anxiety and tension. In the moments in which this desire is more imperious, you must do all that we propose below, and above all, don't smoke. The urge to have a cigarette does not last forever. It only lasts for a few moments, and it does not build up throughout the day. If you are able to resist the initial instance, every time the urge to smoke comes up, at the end of the day, you will see with satisfaction that you have outlasted tobacco. In the most tense moments, relax, using some of the simple techniques that we have proposed above. Learn to fill your lungs with air and not smoke. Remember that you were born without smoking and that you can live perfectly well without smoking. Look at the clock, and while you relax, wait for a minute to pass. After this time, the craving to smoke will be gone. Cravings do not accumulate. Once you have overcome each critical moment, you just have to be prepared for when that craving comes back. Distract your craving. You can drink a glass of water or a fruit juice. You can snack on something to hold in your mouth or chew on. Try to keep it low in calories. A piece of sugar, free gum, an apple, strawberries, orange segments, a slice of lemon, etc. Never use the plastic cigarettes that are sold to replace a real one, as that is also smoking. Don't let yourself be dragged down by negative thoughts. Recognize that it is the addiction that is trying to defeat you, and remember that you can do more than any cigarette. Remember that these bad moments will become less and less intense, and that every day that you manage to go without smoking is a stone that you have. Stone by stone, you will make a wall. The higher and thicker that wall is, the harder it will be to break it down. No matter how strong your dependence is, the urge to smoke does not last forever. On the contrary, it disappears after a short time. The unpleasant symptoms that you may experience during the first few days without smoking are normal and are proof that your body is starting to cleanse and recover. Water and oxygen. Start the day with 2 glasses of water, drinking them slowly, and then 6 minutes of deep breathing. 8 seconds in, 4 seconds inhale, 4 seconds hold, and 8 seconds exhale. 4 seconds hold and 8 seconds exhale. Always through the nose and using diaphragmatic breathing. The water has no contraindications. It is not fattening, as it has no calories, and it will be a great help to dilute the nicotine and other tobacco substances present in your organism. Water is an excellent mucolytic. The oxygen from breathing will also be a great help by increasing the ventilation of the organism. Repeat this operation twice in the morning and twice in the evening. It is also advisable to do it before going to bed. Every time you feel like smoking, sip water slowly and visualize at the same time how the water flows through your whole body, cleansing of nicotine inside and out. It makes you feel good, calms you down, and the urge to smoke disappears. Every time you feel like smoking, breathe in through your nose deeply, holding the air, and then expel it slowly through your nose, at least 5 times in a row, while visualizing your body full of oxygen that cleanses and purifies you, making the nicotine that provokes the physical need to smoke disappear. Never pretend to smoke by sucking and puffing using a pen, a menthol pipette, or something similar, as that is also smoking and will not help you to quit. You must replace sucking with chewing or chewing. Chewing gum or small apples are very good for this. Try to eat a healthy and natural diet. Lots of juices, fruits, vegetable, Mediterranean diet. Avoid stimulants. Spend time at mealtimes. Take it easy. Eat food with high nutritional value. Eating 5 or more servings of fruits and vegetables every day can help lower your risk of certain types of cancer. How to get social support. Several studies have shown that there is more chance of success in any smoking cessation therapy if help is available. Many ex-smokers report that a support network of family, friends, and co-workers was very important during the time they were quitting. Let your family, friends, and co-workers know that you are quitting smoking, that you want and need their support. Ask them to refrain as much as possible from smoking around you, and not to leave cigarettes inside. It is helpful and very positive for you to let everyone, family, friends, colleagues, know that you are trying to quit smoking. It does not matter if someone makes fun of you. Don't let it get to you. The decision to quit smoking has to be your own, not from others. So this point and those that follow on social support may be helpful for some people, but not for others. Ask not to be allowed to smoke. If they see you with a cigarette, take it away. Do not be offered or asked for tobacco. Refuse if offered. Avoid as much as possible that they do not smoke in front of you. If you cannot avoid it, leave the room. Have your cigarette packet taken away if you carry it with you. Be reminded several times a day of your resolution not to smoke. How will I feel the day I quit smoking? Some people feel bad during the first few days they have quit smoking. However, these discomforts disappear within a few days. Some people complain of nervousness, insomnia, bad mood, lack of concentration, headache, tiredness, feeling of frustration. These problems are normal because the body is getting rid of nicotine. To alleviate these effects as much as possible and not be tempted to go back to smoking, you should think about the negatives of smoking and the many benefits you can get from quitting. The negatives of smoking. It is scientifically proven that smoking can cause cancer of the lung, mouth, larynx, throat, pharynx, esophagus, stomach, bladder, kidney, pancreas, liver, cervix, colon, and rectum. It is also responsible for some leukemias. It increases the risk of stroke and heart disease. Smoking also causes premature wrinkling of the skin, bad breath, unpleasant odor in clothes and hair, causes nails to turn yellow, and increases the risk of macular degeneration, one of the most common causes of blindness in old age. If you're interested in learning more about clinical hypnosis, watch our next video, The Positive of Quitting Smoking. Remember to study the description of this video, where you can find a link to free training classes about clinical hypnosis, with several free ebooks too. If you have questions, ask them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.